Welcome to our channel, Know Your Forensics. In today's discussion, we are going to discuss about the toxicological aspects of methamphetamine, which is known as ICE. What is it? It is a recreational drug, and it is considered as a very potent and powerful stimulant of the central nervous system. Currently, it is categorized as a Schedule II drug under United Nations Convention on Psychotropic Substances and in United States. Chemistry of methamphetamine. It is usually a mixture of two isomers known as levomethamphetamine and dextromethamphetamine. Dextromethamphetamine is the neurostimulant, which is the most potent isomer, whereas levomethamphetamine is considered as a nasal decongestant. It can come by many street names known as meth, crystal meth, ice, scooty, yellow powder, and so. We can find methamphetamine in two main forms. The first one is a crystal form, which is known as ice, which has the highest purity, which is around 80%, and whereas the powder form, which is known as speed, which has a 10 to 20% of purity, it comes as a yellow powder form. And when we consider about the related drugs to methamphetamine, we can identify several classes of methamphetamine related drugs. One is known as MDMA or ecstasy, which is 3,4-methylene dioxymethamphetamine, and MDA, which is known as love drug, that is also known as Sally, which is 3,4-methylene dioxyamphetamines, and MMDA, another drug, that is 3-methoxy-4,5-methylene dioxyamphetamines. We are going to discuss about these drugs in a separate video, but in this video we are mainly focusing about methamphetamine. History of methamphetamine. It goes back to 1887, where a Romanian chemist discovered amphetamine for the first time. And in 1919, a Japanese chemist has discovered methamphetamine. He has actually formulated it using amphetamine to create methamphetamine. It was introduced in the United States in 1930s as a treatment for bronchial asthma and as a nasal decongestant, and later it became popular as a treatment for obesity, but it is now rarely used because of the potent neurotoxicity and the possibility of abuse. Mechanism of action of methamphetamine. The clinical effects are somewhat similar to cocaine, where it simulates a sympathetic overactivity, and also it has a very rapid onset of action because it's a highly lipid soluble drug. Methamphetamine causes increased release of dopamine, serotonin, and norepinephrine, which are monoamine neurotransmitters. It can increase their concentrations and their activity by several pathways. Firstly, it can increase the release of monoamine neurotransmitters to the synaptic space, but thereby causing increased concentration of monoamine neurotransmitters in the synaptic space, and also by inhibiting the reuptake of these monoamine neurotransmitters from the synaptic space, and by inhibiting the metabolism of them, and by enhancing the expression of and activity of dopamine synthesizing enzymes. The route of administration used by the drug abusers. It can be taken orally, or it can be inhaled and snorted, and also it can be injected as an intravenous injection. There can be many signs which indicates the route of administration, such as the track marks, the puncture marks, or the skin abscesses, cellulitis in a case of intravenous drug abuse, and also nasal septal perforation in patients who are using the nasal pathway or the inhalation of the drug, and also the persons who are using the nasal and inhalation method can develop various respiratory illnesses. How to identify a chronic methamphetamine abuser in a clinical setup, which can be challenging, but we can suspect that in patients who are having generalized poor nutritional state, extreme weight loss, and poor attention to their personal hygiene, and also they can have various dental conditions which can be collectively known as meth mouth, and also they can have various signs which can direct to the route of administration. Meth mouth is a spectrum of severe dental conditions in a methamphetamine abuser. It can result due to several etiologies, including poor attention to dental hygiene, and also due to xerostomia, which is the dry mouth, which is which is an indirect result of methamphetamine abuse. When a patient uses methamphetamine, they can have an acute, powerful rush which can last up to 30 minutes, but it can vary according to the route of administration. Then they will have a longer period which can extend up to 12 hours, where they have various symptoms which are related to the drug use. It can result in enhanced energy levels and decreased sleep, decreased appetite, and euphoria. Clinical features of methamphetamine abuse. The symptoms which are related to the central nervous system are usually a result of increased dopamine activity, whereas the symptoms which are related to the cardiovascular system is usually a result of norepinephrine activity. Patients who use methamphetamine can have nausea, psychosis, and decreased sleep, panic attacks, erratic behaviors, violent behaviors, and hallucinations, and they can have increased body temperature. And as a result of increased sympathetic activity, they can have high blood pressure and tachycardia. And as a collective effect on the neurotoxicity on the brain, they can develop seizures. What is tweaking? In heavy methamphetamine abusers, they can stay without sleeping for 3 to 15 days. Ultimately, they become paranoid and very irritable, and also they will be requiring more and more doses of methamphetamine to get to their original high state. These patients can be very aggressive, and they can be very unpredictable, and they can engage in various violent activities. So they can be a danger to themselves and also to others. Withdrawal of methamphetamine. When compared to the other drugs of abuse and alcohol, methamphetamine generally has a milder spectrum of signs which are related to withdrawal. They can have decreased sleep, sometimes sleep deprivation, decreased energy and irritability, and sometimes they can have depressive symptoms, and rarely they can have suicidal thoughts also, suicidal attempts also. The most problematic thing when it comes to the management of this patient is the strong craving they are having for this drug, which is believed to be driven by dopamine. Latest research have shown the possibility of developing Parkinsonism and structural changes in the brain in long-term use of methamphetamine in heavy methamphetamine abusers. But this connection is yet to be proven, as most of the research are based on animal studies. Testing and screening for methamphetamine abuse. 10 to 40% of methamphetamine is excreted in urine unchanged, and rest of the drug is excreted as metabolites. So methamphetamine is generally detectable in urine after 3 to 5 days of use. Based on that, there are several established methods to screen this drug in urine in forms of multi-drug screening panels and dipstick tests. Blood, urine, saliva can be used for the confirmatory test also, using the methods including GCMS or LCMS methods. Hair testing can be used to detect methamphetamine use over an extended period, as the metabolite of the drug can get incorporated into the hair shafts. Management of methamphetamine abuse. Benzodiazepines represent the first line of treatment, and antipsychotics can be used as an adjuvant, whereas a combined therapy can be beneficial in the patients who are resistant for the first line treatment. And to manage the concomitant hypertension and tachycardia, we can use alpha blockers and beta blockers accordingly. Death in methamphetamine abuse. They can die due to various complications of the use, where increased body temperature can cause hypothermia and they can die from the complications of hypothermia. And also it can act on the brain to cause direct neurotoxicity, where it can trigger seizures, and due to seizure activities, the complications of seizures, and also due to acute neurotoxicity, they can die. And also they can have various cardiovascular complications which are related to increased sympathetic activity, where they can have acute heart failures, myocardial infarctions, aortic dissections, and also they can precipitate cardiac arrhythmias which can cause death. And they can have central nervous system effects which are related to, again, it can be related to hypertension, where it can result in aneurysmal ruptures to cause subarachnoid hemorrhages and intracerebral hemorrhages. Obviously, they are more prone to get accidents and trauma, as they can involve in various risky behaviors following the use of methamphetamine. Methamphetamine is relatively easily accessible. It has gained popularity among the chronic users and the abusers who are using various other drugs, and it will become a huge burden to the health system of the country. So it is an upcoming social and health issue in the near future. So that's it for methamphetamine, the toxicological aspects. If you have not subscribed to our channel yet, please subscribe and turn on the notifications. And please follow our social media pages, where you can get continuous updates on forensically related content. The link will be in the description. Thank you.